to protect the general good of the public. So basically what the regulator is doing right now is actually causing harm to the very public that they are supposed to be protecting. That is why we are here today, to call them out and tell them that they have to do the right thing. You cannot license people to practice what they did not train. Thank you.
Viva!
Viva!
Maureen.
The association is clear on its recommendations, following what it has observed as of now. We had discussions with Prof. Stanley Khainga, where he assured us that he will bring down the erroneously published scope of practice. This one has not happened, and that is why for us, our recommendation is that he needs to resign, because what he is essentially doing is greenlighting quackery, which the board is supposed to be against. The board is there to protect members of the public. Secondly, we need the board to start following the legal system. There is a court judgment on what the board needs to do. First, it needs to stop licensing the cadres of which it does not know what they do. It does not know what happens if they don't know what to do. It does not know where they take patients if they have messed up. We cannot have such a scenario. So we cannot have the public guessing who is a dentist and who is not. That is why we are saying they need to stop all of that. Halt licensing and registration of these cadres, pending a consultative scope of practice. And what a scope of practice does, it tells you what you can do and what you cannot do based on what you have been taught. We cannot allow patients to be treated by people who are seeing them for the first time in their training. That is dangerous. It is extremely dangerous and unwarranted and unacceptable. We are saying that a scope of practice is a simple document that is created by the professionals, the training staff, and even members of the public are involved, because they need to know what they need to be trained on. We need to know what is the problem of oral health in the country. We have 2 dental schools. As of now, one is shut down. We are saying that these dental schools need to be maintained to be able to offer the high standards of training. And that starts with good procurement system, which enables them to have the things that they require to be able to send out graduates who are well trained. What we do not want to allow is a scenario whereby we are sending people who have never seen a patient to start seeing patients out there, because we know the consequences are devastating. We are currently overseeing some of these complications. Unfortunately, for members of the public, they are not aware. And one of our challenges as an association, and something that we are going to take up very serious, is you are going to start public sensitization. We are going to inform the public what are the services available in the field of oral health care. Where can you get these services, both in the public and the private facilities? We are actually in the process of engaging legal services so that we also force the board to do the right thing. Unfortunately, sometimes it comes to that, but the Kenya Dental Association is prepared to go the whole 9 yards, because for us, the outcome and the repercussions, if we do not do anything, are very dire. And that leads to public safety, public harm, and we do not want such a scenario. Thank you.
Could you specify the two schools and the one that is closed?
The 2 schools that we have offering dental training for dentists are the University of Nairobi, where we are at the moment, and the Moi University. As of now, the Moi University School of Dental Sciences has had to close. And why has it had to close? And this is temporarily, hopefully, because they do not have, for you to be able to see a patient, you need gloves, you need a face mask, you need protection, you need materials to be able to do fillings, you need materials to be able to do extractions, to be able to numb the patient. Without this, unfortunately, the guidelines are very clear. You cannot substitute, you cannot start harming patients because you do not have the adequate or the ideal tools that you need. So that, unfortunately, the Moi School of Dental Sciences has had to close, and it's something that we are looking up, and we wish that the Ministry of Education comes to support, because the same is going to happen to the University of Nairobi. We are seeing students buying materials. Students are not supposed to buy materials. They are supposed to come and learn. If they start buying materials, it becomes expensive. It disadvantages those from a poor background. It makes dentistry the cost for the rich. We do not want that. We want a fair availability of dental service training to everyone in this country, as long as you have qualified and you have gotten the grades necessary to get into dental school. Thank you.
So currently, other than the illegal scoping and the illegal licensure, we have SHA. We all have SHA. And our SHA is not working as regards dental care services access. We call upon the government, as they have been engaging, as they have been saying that they're going to do something right for the members of the public who are contributing towards SHA, that they need dental care services. SHA, as currently stated, it does not provide dental care benefits. And that makes dentistry access expensive. If you are going to contribute to SHA, the government must allocate commensurate benefits on the dentistry cover under SHA. Because we are Kenyans and we all deserve the highest attainable standard of healthcare as enshrined in the Constitution. That must happen. So we call upon the Ministry of Health to fast track the discussions and consider the tariffs review to provide adequate and commensurate benefits as per contributions made to each family and each household in regards to the matters access of dental care services. Thirdly, as we finish, we have dentists in the market, many dentists in the market, and we have public facilities without dentists in the market. The dentists out here need to come out and serve Kenyans. We call upon the government again to consider, to recruit and employ the county governments, all these dentists that are out here, to continue serving Kenyans and providing quality and adequate dental care services. We cannot live with counties that have only a single dentist. That is illegal, that is without standards, and dentists are available to provide that much needed healthcare service. Thank you.
Thank you.
Khainga mask. Khainga mask.
Nimechoka mkono.